Hello, everybody. Welcome to No Diabetes by Heart, our Facebook Live program today, which is an effort to raise awareness between heart disease and folks with type 2 diabetes. No Diabetes by Heart is a collaborative initiative under the auspices of the American Heart Association and the American Diabetes Association. So I think what I'd like to do is jump in and let our panelists introduce themselves. So first, why don't we go to Dr. Patel, Mitul Patel, who we both are at the University of California, San Diego. I'm in the Department of Endocrinology and Diabetes and Metabolism, and Mitul is in the interventional cardiology realm. So tell us something about yourself. You never want to see this guy except solely, I'll tell you that.
Thanks, Dr. Edelman. Yes, so Mitul Patel, I'm an interventional cardiologist at UCSD as well as the VA hospital here in San Diego. I see patients with blockages in their coronary arteries as well as blockages in their peripheral arteries, for example, their legs, etc. And I manage most of those blockages mechanically by opening up blood flow with stents. So essentially, I'm a plumber when it comes to the cardiovascular space, and I enjoy doing this. I've been on faculty here for the last 10 years, and I've shared a lot of patients with many of our endocrinologists. So I appreciate the invitation. Thank you.
Yeah, I mean, our goal is really to put you out of business with a program like No Diabetes by Heart. Unfortunately, heart disease is one of the most common ways people with diabetes pass away. And we need folks like you to help undo these clots. And I think the whole initiative really is for prevention, but if you already have heart disease, then you want to delay the progression. So Hyvelle, please introduce yourself. I know you are an ambassador, not at the United Nations, but you probably could be. So please introduce yourself and tell us something about the ambassador program.
First of all, I want to thank you, Dr. Edelman. I'm honored to be an ambassador for the American Heart, along with the ADA for the initiative, which is so needed in this time. And I thank God for the information that's available, and just getting the information out is how you fight. How do we win against a catastrophic disease? And just knowing the arsenals that are there on the website that can help you out. I wish the initiative was there when I first started. So I thank God, and also American Heart and ADA in reference to the whole ambassador as far as being a face. Like I said, I'm an ambassador, but I am a patient. So I'm coming from a personal perspective. And I wouldn't want one person to walk through my shoes as far as seeing the endocrine or even having a stent or even a heart transplant. It's a lot to go through. And I think it starts by preventative. So American Heart and the ADA, this initiative, it's much needed. So I thank you guys.
Well, we want Dr. Patel to have to go to apprenticeship to be a real plumber because the business is down so much. To be realistic about it, that's not going to happen anytime soon. And there's so many people with diabetes in the United States and around the world, and access to the proper preventative measures is always a tough thing. Well, tell us your personal story, and then Mitul and myself can comment on what your personal story is with heart disease and type 2 diabetes.
Sorry about that. Diabetes, it's a tricky issue. And if you're not, understanding the facts, you look at my face and you wouldn't see the struggles that I've been through. I've had a stroke at 41. I had a heart attack. I ultimately I had a quadruple bypass. And after that, there was a few revision surgeries to fix some native vein that got blocked. And so it all started, which I didn't know. That's why I am so at awe of this initiative, because I was told that, I have diabetes. My A1C at one point was 12.5. And I was told that I was in a danger zone, but I thought I was immune. I thought I was young. And we need to get the word out. Like I said, my mother, hereditary, it was in our family, and she never really discussed it. We know about it. Oh, we have sugar. Yeah, take your medication. But do we truly understand and make the connection or the link of understanding if diabetes is not under control, that it's going to engulf and take on all type of stuff that we don't want to go. So I am so grateful. Like I said, my mission in life is to spread awareness, because especially in my community, as far as diabetes and how prevalent it is in the African-American community, it's not a joke. It's seriously. So we have to start preventative. So I just applaud you guys for starting the conversation, because everybody that I meet, I tell them, hey, what's your numbers? Because the numbers speak volume. And I understand that fact because I didn't understand that before.
Yeah, one thing. I'll say one thing, and I'm going to hand it over to Dr. Patel. Is that you're right? You look extremely young. You look vibrant, and people don't realize that there could be a lot of underlying risk factors. And your African Americans have a very high rate of type 2 and heart disease. So, having a stroke and a heart attack at a young age, that's a wake-up call for sure. And thank you for doing what you're doing. Mitul, any comments on the story that we just heard?
Yeah, Hyvelle, I'm very sorry you've had to go through all of this. It's obviously unfortunate, and in the arenas that Dr. Edelman and I work in, we unfortunately see this far too often. And it's just exactly what you said. The awareness is not out there, because diabetes kills people silently. It hurts people silently. You don't feel diabetes. It's not like back pain. It's not even like chest pain in people that don't have diabetes. It doesn't limit your ability to walk. It doesn't limit your ability to interact with others and converse. And so when it doesn't impede the things you like to do in life, a lot of times it's swept under the rug and ignored. And you're absolutely right. The message has to get out to people that they need to see their physicians regularly. They need to be screened for diabetes. And if they have diabetes, they need to be managed early and often. And a lot of that is lifestyle adjustment. It has to do with diet and exercise. It's not necessary that you have to start medications if this is encountered very early and addressed very early. In fact, my success stories are not those where someone's come in with a heart attack and I've opened up an artery and restored blood flow to their heart. My true success stories are those that happened to somebody, but then they made the appropriate lifestyle adjustments, and now they're only on aspirin and they're exercising and eating right and they feel great and they have no limitations. Those are the success stories in my area.
Yeah, thank you. Well, looks like we have another guest. This must be Jacqueline.
Yes, hello. Good morning, everybody.
Hey, thanks for joining us. Perfect timing. We're at the point where we want you to tell us your personal story about heart disease and type 2 diabetes. It looks like you got your support person right there next to you, which I think is very, very important. You guys just got married, or the way you're hugging?
Just yesterday, 37 years ago.
Really? Because I'm thinking it's only like 1 or 2 years, the way how close you guys are. No, tell us your story. And I know you're an ambassador, and we'd love to hear it and how you got involved in the program.
Well, I am a heart survivor, a stroke survivor, and I was just recently diagnosed with diabetes, just to top it all off. And, since all of that happened, I also, became a volunteer heart and stroke survivor and diabetes patient advocate. And this is my wonderful husband, Sadek Alikhaani.
Hi, everybody.
And he's also a heart and stroke survivor, and also my partner and volunteer healthcare advocacy to help increase awareness and support for heart health and diabetes. And what happened to me was really caught me by surprise, because I had been diagnosed with heart disease, and then following that, I was diagnosed with diabetes just less than a couple of years ago. And I was really caught by surprise because it runs in my family, And yet, you know, it happened to me too. And I just thought I was just way too young to have to be concerned about getting heart disease or diabetes. And so what happened is that I had, you know, I was not feeling well. I went to ER, and that's right after that is when they diagnosed me with diabetes. I had been pre-diabetic for years, and I should have paid attention. I should have paid attention at that time, but I just didn't know what I needed to know about how these conditions are connected. I had no idea that diabetes and heart disease were related. I didn't know that diabetes could help to spearhead heart disease, and I also didn't know how it could make it worse. And when I was pre-diabetic, I just sort of pushed it to the side and said, you know, wow, I'm not diabetic, so I don't have anything to worry about. I'm not that. We, you know, I'm in good shape. And I didn't have any background and knowledge about diabetes, even though it ran in my family. I didn't know anything really about it. And so that's why I thought that it was something that I would get, you know, I would be at risk for when I was like 80 years old or something like that.
Yeah, well,
And that was, boy, was I wrong.
thank you for that. You know what? You said so many important things. I'll just say real quickly that, you know, in the world of endocrinology, diabetes, you know, the pre-diabetes to me is just part of a continuum to type 2. And, you know, I think the onus might be on our caregivers that may downplay the word pre-diabetes. I think anybody with pre-diabetes, in fact, many times people say they're pre-diabetic and you do some little more formal testing and they're clearly full-blown person with diabetes. And part of this initiative is that everybody viewing should say, if you have type 2 diabetes, you definitely could be at risk for heart disease, whether you're young, whether you have symptoms or not. And, you know, if you have heart disease and a family history of type 2, you know, it's funny how you sort of put that out of your mind. You didn't take it seriously, but they're so tightly connected. And your story is so similar out there. Dr. Patel, I mean, I would say your comments on the incidence of heart disease in younger people, like our two ambassadors, but also maybe a little bit about why people with type 2 end up with such a high rate of heart disease. Get into a little pathophysiology. I know you're just a plumber, but maybe you can deep dive into that a little bit.
No, absolutely. So, you know, what diabetes does is, in terms of the cardiovascular space, it essentially cakes the blood vessels with plaque. And, you know, the processes are very deep and molecular, obviously, that lead to that. But it's a systemic problem. It's not just a problem of one organ or another. It affects every organ. And it starts with the smallest blood vessels in the body. So the blood vessels that supply blood to the eye, the kidney, and the nerves. And thus, patients that don't address their diabetes suffer from vision loss, suffer from neuropathy or nerve pain, and ultimately suffer from kidney disease. Later on in its course, it affects some of the bigger blood vessels that supply blood to the heart, the brain, and whatnot, and leads to things like heart attack and stroke. But unfortunately, a lot of the times, by the time people present with heart attacks and strokes, a lot of the small vessel damage has been done. And that's why it's considered the silent killer, right? You don't necessarily feel when your tiny blood vessels in your eyes, your kidneys, and your nerves are affected. Unfortunately, you feel the ramifications of that further downstream. And so, to your point, Steve, it's something from a provider perspective that we should address very early on. The pre-diabetes is, the analogy would be, you know, when your car starts making a funny noise, you go and get that looked at by a mechanic, right? Unfortunately, with diabetes, there's no funny noise or funny sensation that initiates your alarm system to say, okay, well, I need to go get this addressed. And really it's screening. It's screening, and it's making sure that you're doing the right things from a health perspective early on in terms of your diet and exercise habits.
You know, I'll add something to that. You know, when you look at high cholesterol and high blood pressure, which are two big risk factors for heart disease, they're pretty much asymptomatic. If your blood pressure gets through the roof, you know, you can get a nosebleed, but most of the time you don't really feel when your blood pressure is high. And if your cholesterol levels are through the roof, your LDL, the lousy level, doesn't feel that bad. And then of course there's the clotting issues as well. So there are multiple things we can do to prevent coronary artery disease in people with diabetes and people without. And I think I want to ask both our ambassadors here, if you could address the audience and say, what advice could you give them when they walk into their doctor's office if they think at all that they may be at risk for heart disease? And don't forget, the most common cause of passing away in this country is heart disease, whether you have diabetes or not. It's just higher if you do have type 2 diabetes and type 1 as well. So one thing we do with the not-for-profit that I run, Taking Control Your Diabetes, is bring that to the forefront. And it's awareness is half the battle. So maybe you guys can jump in and make a comment, Jacqueline or Hyvelle.
Yes, I'd like to make a comment on what Dr. Patel spoke about as far as the warning signs. You know, I experienced a lot of this stuff and I didn't understand as far as I had to have laser surgery. The lethargicness, I always reached for a Red Bull because I was always tired. And there was an incontinence issue, which I'm not afraid to talk about. I urinated a lot, not knowing that these were all signs that was trying to tell my body was trying to tell me something that I wasn't paying attention to. So if you're struggling with diabetes and you see that you have certain stuff, like, you know, incontinence or frequent urination, sleeping and tired, vision issues, neuropathy, you know, I'm only 47 years old and I've hit the gamut of side effects as far as diabetes. And, you know, it relates to heart. So as far as making sure, because like when I said, I was only 41 and the first time I got an EKG was after my stroke in the emergency room. So my thing is preventiveness. So go to your doctor, make sure that you go ahead and see a specialist. You know, heart disease in women is completely different from men. And now you throw diabetes in the mix, you're at greater chance. So the communication as far as getting a care team, it's vital because the clock is, once you've been diagnosed, kind of the clock has already started. So what you want to do is get a care team, get the conversation started, but make sure go to No Diabetes by Heart to arm yourself with the information that will help you start the conversation, because I find that when I know better, I did better. So the information is there and I hope that everybody joins in. But this is, like I said, from a personal aspect, I've been through it and I would want one person to experience my personal health.
Yeah, knowledge is power. And, you know, Dr. Patel brought up the car example. Well, I could bring it up too. I mean, if you have if your car makes a funny noise, I have a Tesla, it doesn't make any noise, but if you bring it to the dealer, if you know something about cars, you're going to have a much better conversation. You're going to understand what he or she is telling you, what's wrong with your car. And you know what? I think it just emphasizes the importance of, I would call it patient education. We all have to become knowledgeable. And yeah, there are some doctors that are more up to snuff than others. We're going to talk about that in a second. And you don't want anything to be missed with your health. So that's why you have to take the main responsibility. Jacqueline, any comments and reflections on that?
Well, you know, it's really important. Just, you know, I just resonate with what Hyvelle said, because all of it, it's so true and it's so correct for me too. A lot of it, you know, a lot of what she says applies to me. And I think it's very important to have a cardiologist, get a cardiologist as soon as you can, so that you can be, you know, seeing that doctor on a regular basis. Also, very important to have a primary care physician, someone that you can let know about any symptoms that you have. And because a lot of times all these symptoms, you might not necessarily know, what they mean. And that's what happened to me as well. I didn't know the symptoms for diabetes very much. I mean, I'd heard a lot of people talk about this thing called sugar, and I'm like, sugar? Oh, wow. That doesn't even sound like a really bad thing to be concerned about. It's a nice, sweet thing, right? So, but
They used to say a touch of sugar.
a touch of sugar.
That was a very
Yeah.
common statement back then. Yeah. And, the fact that it still ran in your family, it still didn't, register that because, of the people around you not making a big deal of it, maybe not talking about it at all. And if you could go back and give your doctor any advice in a constructive way, what would you give him or her to raise this awareness between diabetes and heart disease and type 2 diabetes, like in your case, Jacqueline, because it came in that order?
Right. I would ask the doctor to really emphasize prediabetes and what it means. And so when people are pre-diabetic, like myself, if someone had emphasized how critical this point was and encouraged me to take a diabetes education class at that time, I would have been able to, probably edit this whole thing off, just, prevented this diagnosis of having full-blown diabetes. I think the time to encourage people to get to take those classes, get educated, get informed, is while you're pre-diabetic. And I just thought I was out of the woods. And I also have to tell you that at that time, when I was diagnosed with prediabetes, I didn't have a cardiologist. I didn't actually really have a primary care physician. I mean, all of that happened after the fact. I was going to the doctor regularly, but I would just randomly, make appointments when I didn't feel good. And that should have been, the wake-up call for me, but it wasn't, because I just didn't have the education about these issues.
I would just add to what you've said, Jacqueline, that prediabetes is a serious wake-up call. Now, I would just say that if type 2 runs in your family, that should be a wake-up call, and you can even institute lifestyle changes before you're pre-diabetic, because being pre-diabetic is just an artificial definition, to be honest with you. Jacqueline, if you could go back and talk to your doctor before you ever had any cardiac issues, what would you say to him or her?
I would say to, before I had any cardiac issues, I would say to emphasize, that you right now, you're on the right track. Watch what you eat, watch your diet, eat heart healthy, low sugars, low fats. I would emphasize diet and movement, exercise.
What about you, Hyvelle?
I would emphasize that the conversation needs to start. And from a doctor aspect, as far as, yes, most definitely diet. Diet plays a major role. I know from my family, an African-American community family, it's saturated fat, sugars, iced tea, and Kool-Aid. So the urgency is now. We can't be doing the same thing thinking we're going to have different results. So it starts from the home aspect. So there needs to be a nutrition, a dietitian, and it's all hands on deck. I look at my children because I've modified my cooking. I don't want to leave a legacy of what I've went through. So it starts in the home. So we understand, we know the link between nutrition, exercise, and food, and the role it plays in our body. I'm not saying to say medication is necessary, especially dealing with type 2 diabetes. Get with your endocrine, get with your care team, make sure it's sync. Make sure the lines of communication is open. And for everything I tell everybody, know your numbers. You get your lab work, don't even, get an actual copy from the doctor, because now we have to take accountability. Doctors, I'm not saying that, they're busy, but they are busy. But if you want to live, it starts by taking that initiative, being your own advocate, and understanding that your life matter by taking this one simple step at a time and, moving from there.
That's such good advice. I love that. Well, Dr. Patel, we're going to get back into the science of things a little bit. We've been talking about heart attacks and strokes, which is, obviously when your heart muscles die, you don't get enough blood. And when you have part of your brain tissue dies because you don't get enough blood going there. Let's talk about the kidneys and why does the kidney issues parallel heart and stroke issues?
Yeah, so that's a great question, Steve, and I think it's somewhat nebulous to a lot of folks out there. But the kidneys, as I mentioned, get affected by diabetes because the small blood vessels in the kidneys get obstructed, and ultimately the kidneys fail. When the kidneys fail, it causes issues with blood pressure. It causes a lot of calcium buildup in blood vessels that are not necessarily around the kidneys, so the heart, the carotid arteries, the leg arteries, and ultimately that leads to challenging issues in terms of blood flow to those organs, and it poses challenges to the providers that go and try to repair those, because calcium is something that we have a lot of trouble handling. So that's one of the major connections with kidney and other organ dysfunction. Plus, needing dialysis is an awful thing. Of course, our nephrology colleagues see a lot of patients with diabetes, and those patients are relegated to 9 hours a week at a minimum, sitting at a dialysis center getting dialyzed, and that's also something that really impacts lifestyle, impacts the ability to do the things you want to do.
Yeah, thank you. And I'll just mention here that when we talk about the heart, the brain, the kidneys, when we talk about prevention, as a provider, and Dr. Patel, is that we have kind of I call it the ABCDs. And so, we talk about the hemoglobin A1C, which is just diabetes control, and perhaps being on a blood thinner like aspirin. We'll talk about that a little later. And then B is blood pressure, C is cholesterol, and D now is a whole new category. D stands for drugs, not the drugs that lower cholesterol or blood pressure, but we now have drugs that actually are diabetes drugs that also can protect the heart and the kidney, and that's extremely important. And so there are a lot of preventative strategies. And then both of you, Hyvelle and Jacqueline, mentioned lifestyle, and there's no drug alive that's going to overtake bad lifestyle. So it all has to work together, and working with your caregiver. And, like you said, Hyvelle, knowledge is power. So, I think the next thing we can just talk on briefly, and then we have a whole list of questions coming in, is that, you too have gotten motivated and getting involved in the No Diabetes by Heart Ambassador Program. And what's your message to other folks out there who may have had a heart attack or stroke? What kind of, I know it's been a tough emotionally. I couldn't imagine having those issues at such a young age. And what are some of the personal reflections and advice you would give others that have had cardiovascular, stroke, other complications that you two have had? How do you get through it? Anybody want to tackle that first? Hyvelle or Jacqueline?
Well, for me, there's so much to learn, there's much to know. You have to be organized about it. I was really surprised at the amount of organization that I had to learn to do. And when I ended up in ER, and then after that, they had to put me on insulin, then that was really it felt overwhelming. First of all, I don't even like the sight of blood. So the idea of having to prick my finger and check my blood every day for who knows how long, it could be for the rest of your life. So that you have to be organized, and you have to take your medications on time. You have to do everything you're supposed to do, and you have to make sure you keep your doctor informed about your symptoms and side effects that you're having, so that the doctor can adjust your medications, as necessary. The organization of it all. I mean, I had to buy a little kit to keep everything in. It's a lot. It's a lot to do. I didn't know that.
It becomes part of your lifestyle. Well, just real briefly, I'd like to hear from your husband, because having a good partner is always so important in managing diabetes and heart disease. Do you have any few words of wisdom for our viewers, the way you snuck in on this program? I love it.
I do. Just like Jacqueline just mentioned, the lifestyle changes basically based on she's not the only one who's suffering from whatever she's going through, but just I'm going right along step by step, day by day. And therefore I had to also tackle this my way if she's not able to tackle it alone. And then I just simply decided that I go to doctor with her every single appointment, because whatever she's learning from that visit, I'm going to have to know about it. Yeah. Before that, I used to get some kind of a feedback from her when she came back from doctor visit. About 1/3 of the information made sense to me. So I had to educate myself just right along parallel to what she was going through. And then actually give feedback to the doctor from what I see from outside that she might not notice, but I'm just the outsider and I notice it, and I just mentioned to the doctor. Those were some positive points that we really learned. On top of it, being an aerospace engineer, I just like to learn how the plumbing works, basically.
Well, you know what?
And
I'm sorry.
And I just went and studied right along with her, just reading my own books, reading, from any sources of information that I can educate myself so I can be more helpful to her right side along.
You know what? That is so important for all of you out there, having someone to support you. Now, you've had issues yourself, but I love when one of my patients comes in with a significant other, a friend, a wife, a brother, because you're kind of intimidated a little bit. You're rushing in, and sometimes you don't hear what the doctor said.
Exactly.
They've done some very interesting studies interviewing patients the minute they leave the room, and they'll ask them, what did the doctor say? And then they'll interview the doctor and say, what did you tell them? And it's like only 20% overlap. So it's good to have a second set of ears. Hyvelle, what kind of words of wisdom do you have for people watching? And do you have a good partner helping you through all this?
Yes, I have my sister. Actually, when I had the stroke, they wanted to release me, and I had, it was a slow bleed. And if she wasn't there, I don't know what would have happened. I went home and stuff would have happened differently. But my advice to anybody, especially if you've just been diagnosed, or you have a family member, or you're pre-diabetic, like I said, or you've been, diagnosed with diabetes, today is a day. Today is an opportunity. I wouldn't want you to go through, like I said, my personal health. So it's important that we become proactive. Living with diabetes is not a stigmatism. You can thrive, you can live. And all you have to do is, and I think back of what I went through, and I thought about all the control I gave up. I could have said that, my family, my mother had diabetes. Oh, it's in my blood. I had to take personal accountability and start working from that point. Granted, it's not easy, but if you have a team with you, you have a doctor, and you're motivated, because there was at one point that I needed someone to do the basic needs because I couldn't get out of bed. So today starts that clock. Today is urgent, because life is not guaranteed, and it's all about taking control and starting where you are and thriving, making that link between diabetes and heart disease, and understanding that you too can fight the smart fight.
Wow, you know what? One thing that comes from you, Hyvelle, is a sense of urgency, and I can feel it, That's such a good message. Well, we do have a bunch of questions. Some of them are doctor related, some are ambassador related, and we have Megan as a phantom guest looking at the Q&A stream, so I don't have to be going like that during the program. Megan, you want to ask us some questions?
Yeah, we have a couple. So one of the first ones is actually from a T1D, and they've had it for 40 years, diagnosed with CAD April 2019 with 3 stents. the question is diet, how to balance a diet for both diabetes and heart disease. The dietitian recommended whole foods, plant-based, but that seems too carb heavy.
Well, yeah, I don't think we have time for a dissertation, but to summarize her question, T1D, someone with type 1 diabetes, people with type 1 diabetes like myself, we get heart disease as well. So we're kind of all in the same boat a little bit. Preventative strategies are pretty much the same, the basics. Mitul, do you ever counsel your patients on diet, or being an interventional cardiologist?
Yeah, I do, and I'll be honest. A lot of my knowledge comes from my wife, who, as you know, Steve, is an endocrinologist. So, but some of it too is common sense, and it's okay. So if you're type 1 diabetic, obviously you are well aware. If you've had it for 40 years, you're well aware of how to count carbs in your diet, and you're probably better at that than any doctor out there, other than Steve, who suffers from that as well. But in terms of the overlap between cardiovascular and diabetic diets, I mean, essentially we want a lot of the same things. Yes, we want to limit the carbohydrates, concentrate on a good amount of protein in the diet, a good amount of greens in the diet. Fruits are obviously okay, but you want to limit those from a carbohydrate perspective. So it does take a lot of effort, as Hyvelle and Jacqueline have emphasized. It takes a lot of effort. It takes a lot of discipline. But there are resources out there, and I do counsel them. I do send them to nutritionists as well. We have an amazing cardiac rehab program here at UCSD that I refer a lot of patients to, and they provide not just an exercise component of rehabilitation, but also a lot of nutritional advice.
Yeah, I'll just add, what you said is so important. A lot of it's common sense. Both Hyvelle and Jacqueline, you realize that just getting recipes that pay a little attention to saturated fat, salt, and concentrated carbohydrates, like desserts and rice and potatoes. And of course, all of us like these type of foods. So I think also moderation is the key. You can't eat a certain way your whole life and say, okay, you're not going to ever get that again. So, that old saying, we are what we eat. For people with diabetes, it's we are how much we eat. And so I'm sure both of you taking a proactive stance have changed the way you eat. And I don't think you're probably suffering and walk around saying, hey, I hate my diet. You can find something. Any quick words, because we have a lot of questions to answer. Any quick additions from our ambassadors?
Yes, I'm an advocate for eating and modifying, because like I said, African American community, it's all about food. And I suffered from the fact of it had to have taste. So I started modifying, going back to spices, cutting out the oils and looking for better oils. So it takes an education, but I bring my children into the kitchen and we cook together. I'm bringing more greens, and I noticed that we're staying away from like the dairy, and we're staying away from the cheese and the bread more. That I am bringing them in and introducing living foods. And it's all about taking accountability, like I said, but recipes. There's a plethora of recipes out there that can help you. Just get active, in the kitchen.
And I would just say that the No Diabetes by Heart is a great website. Taking control of your diabetes. We always have tons of great recipes. A couple of them I have put on myself, including, the egg beater omelet, which is very good. I'd suggest you look at it. The American Diabetes Association, the American Heart Association, there's probably no shortage. Well, Megan, let's go to the next question. We'll try to answer as many as we can.
Yeah, so this, we talked about diet. So the next question asks about how exercise and activity can mitigate the impact of diabetes on heart health.
Okay, well, why don't we ask Dr. Patel? He looks like he's in great shape.
No, it's, you don't have to. I always tell my patients, it's not that you have to join, and of course, during this pandemic, going to gyms isn't really an option, but you don't have to join the fanciest gyms and pay a lot of money. You don't have to have the, amazing yoga outfits and go to do yoga in these exotic studios. Really, all you need to do is walk. You need to walk 30 to 45 minutes every day. And what's amazing about that is not only is it helping with blood flow everywhere and keeping your heart in good shape, but mentally, I think it provides a lot of benefits that people don't realize. Walk with a loved one, walk with a pet, get out there. And now we live in San Diego, so we can walk almost every day and have no really excuse for it. But if you live in a place that's either hot or cold, find a mall to walk in, find a treadmill if you can get your hands on one. Or a bicycle. There are many forms. Just stay active, but make it fun. Make it fun and make it social. And I think that will keep you engaged and keep it going.
I can't add anything to that. That's perfect. Well, Jacqueline, we didn't get a chance for you to jump in on the diet question, but let me ask you, was there a point in your life where you were not active at all? And if you're active now, how did you make that switch?
Well, yeah, I have also other medical conditions. For instance, I have arthritis. And so that makes it difficult for me to do a lot of the movements I'd really like to do because of my knees. So what my doctor prescribed for me was some pool therapy and also, a bicycle, using the bicycle. And you can have a stationary bike. So, and that's something that has helped me a lot. And just any kind of movement, I think it's really important, whatever you can do. And if I'm not feeling well enough that I feel like I need to lay down, then I took therapy and my therapist showed me exercises I can do, while laying down, and you can still keep moving. And my husband and I take walks as much as we can on the weekend. We like to walk at the beach. That's one of our favorite things to do. We have a lot of fun doing that. And my husband has really been incredible in encouraging me to do that, because if I'm feeling a lot of pain, then sometimes it's hard for me to get motivated to move. So
Yeah.
he'll after dinner say, hey, let's just go for a walk. Just lean on me. And I love him for that. I love to lean on him and all kinds of things. So.
You guys should be on the Newlywed Game. I know a quick one-liner on exercise for you. I want to get to the next question.
Okay, exercise. The fact of, I suffer from heart disease and some days are not good. But the days I can, and I kind of work my day backwards. I learned from my therapist the fact of do what I can do on the front end and then leave time for rest, which is so important. I'm not where I need to be, but every day I can walk, I do walk, because walking, I think, helps that blood flow. So I'm grateful to do that.
Really, really good advice from all of you. And once again, you don't have to get the fancy spandex and go to some yoga class, and you can't go to the gym anyway. But for people that are on a lower budget, the YMCA's always have programs where you can get into a pool, and if you have arthritis. So really good practical advice. Okay, Megan, we got time for a couple more.
Okay, next up, just any advice on getting access to the right provider team for diabetes and everything that comes with it?
Well, that's a tough question, because it comes down to how good is your insurance and are there services in your area. But I would start off by calling your local American Diabetes Association or even your local American Heart Association. Talk to your friends who may have diabetes, and of course whoever your primary doctor is. Most of the time, if you ask, they will bend over backwards to get you there. A lot of times they're not thinking that. Ask them if you have access to a diabetes educator, or even a dietitian, or an exercise physiologist that works in a cardiac rehab. So I had a patient say to me one time, I would have loved to have gone to the cardiac rehab center before my major heart attack. The only time you can get in there is if you've had something serious happen to you. So I think, Megan, the answer to that for the person who wrote that is you have to be aggressive, and you have to be, constructive and ask around. And most of the time, if you ask for it, you will get it. What's the next question?
What diabetes medications are good for the heart and kidney?
Okay, that's a great question. Let's start off with Dr. Patel, and I'll jump on that because this is a whole new area in treating heart disease, because we have discovered that a couple classes of medication, they not only lower the glucose, they do not lead to weight gain, they do not cause hypoglycemia. So they're really good diabetes drugs, but then based on many large, what we call heart studies, that they are protective of the heart. That's really important for our viewers today. So Dr. Patel, give us your opinion on those.
Yeah, no, it's amazing that some of these drugs that were developed to manage diabetes are having profound improvements from what we call cardiovascular endpoints. So reducing things like heart attack, stroke, reducing things like heart failure, or even treating patients with heart failure that may or may not have diabetes. So the SGLT2s, and I'll be honest, I don't know what all of those letters stand for. Steve does, I'm sure. Jardiance and Farxiga have both kidney and heart failure benefits. And then the GLP-1s, drugs like Ozempic, Victoza, those have more heart disease, meaning blockages in the heart arteries or coronary artery disease and stroke benefits. So those are, in addition to things like statins and ACE inhibitors, which manage cholesterol and blood pressure, now we have specific diabetes targeted drugs that have cardiovascular benefits.
Yeah, and there's a lot of fancy names here. The SGLT2s, the sodium glucose lithium transporter 2. I'll get really scientific on you, but you mentioned two of the very common ones. Jardiance, Farxiga, and then the GLP-1s. These classes have been around a long time. Bydureon. We got Trulicity, Ozempic, Victoza. You've seen the commercials. And this is something that you don't need to remember from this particular Facebook Live, but it's really important to ask your caregiver. And all you would have to say is, some of these newer diabetes drugs protect the heart and the kidney. Am I eligible? Would they help me? And I think that's the awareness thing. And I do think, just like Hyvelle, there's a sense of urgency because these medications do work in multiple ways. They reduce, the SGLT2s reduce heart failure, which is very common out there. So I think that's important issue that our viewers need to know. And that's something that Dr. Patel and myself do when we talk to medical students, residents, primary care doctors, even other endocrinologists that may not be as knowledgeable as we are, because we're at a major university, we do clinical research, and we have to stay up on this information. I'm sure both you, Jacqueline and Hyvelle, have heard of these medications. You might be on them as we speak.
Well, I am, taking, medications prescribed by my cardiologist and my endocrinologist. And what I really love is that my doctors talk to each other, because I have several, different medical conditions.
Probably married like Dr. Patel and his wife. Hopefully they talk to each other once in a while. You know what? Communication with each other is key. And nowadays, how medicine is so segmented, depending if you're in a combined system like the University of California, but sometimes doctors never speak to each other, which brings up Hyvelle's point. You need to be the person that knows all your information, bring it from one doctor to another, and get them to communicate with each other. Hyvelle, do you have any comments on that?
Yeah, I would like to add, I told you guys before, my A1C was 12.5. I was on insulin. I was on shooting up, like basically because I was pre-diabetic also, and I had gestational diabetes. And today I can actually say my A1C is 5.4. And that's just through dietary. I lost like about, I think, 95 pounds. So I'm weaning myself off. Like, so if you're on a medication or even insulin, there is life. Modify, keep on walking, drinking water, ditch the soft drinks, because I make my natural drinks now, no sugar. So it's important that you get proactive and gain control. and go to No Diabetes by Heart. There, like I said, there's the information is there. And once you know better, you'll take the steps. And it's one step. It's one move, one day.
Yeah. Wow. You should be president of the United States. I'm serious. I'd vote for you for sure.
The urgency is now. The urgency is really now.
That's right.
Yeah.
Mm-hmm.
Yeah. Okay. I've been told we have time for one more question, and then we'll do our little goodbyes. Megan, go ahead, please.
Are there any diabetes medications to avoid if you have heart and kidney disease?
Dr. Patel, what would you say to that? It's a good question.
Yeah.
Really good question.
So years ago, they found issues, a class of medications for diabetes called TZDs that were suggested to be avoided for patients with heart failure. I think it's very important, again, to be an advocate for yourself and to make sure that you're looking into all of these. Most of your providers, when they prescribe them, they look for contraindications to certain drugs. Things like ACE inhibitors, which is a class of blood pressure medications, are generally good for diabetics and those with heart disease, especially those with heart failure. But if you have advanced kidney disease and have trouble with potassium, they may be contraindicated. Statin drugs are generally well tolerated and indicated for both of the conditions as well. So yes, there are some contraindications, but for the most part, your provider should be looking into those. As long as you're advocating for yourselves, you should be okay.
I think, people that are not in the healthcare profession, there's a lot of fancy words, a lot of mechanisms, but there are, medications have side effects, even the best ones on the market. And we just have to, you talk to your caregiver, and we talk about the risk benefit ratio. We look at the risk, we look at the benefits, and then we can make a decision between the person, the patient, and the provider. So it's really a joint decision. And there are situations where you may not want to be on a medication. You mentioned a drug called pioglitazone that can cause congestive heart failure. It's a good diabetes drug, but it's not for everybody. So that was a good question, Megan. Thank you very much. Well, I think we're getting close to the end. It's been an awesome session. I think what really made it special is having a cardiologist, but even more than that, having two people who have lived through, unfortunately, a very common scenario of not being that knowledgeable just because you're not a doctor, and having, heart attack, having a stroke, and living through it. And now I would say living an extremely healthy and good life because you've taken an active role in your condition. And so no matter what condition we're talking about, whether it's diabetes or heart disease and others, I think knowledge is where it's at. And people living with diabetes have to be the most knowledgeable. So I think with that, why don't we just let each of you say one or two lines as a parting goodbye. And I want to save Hyvelle for last because she's going to tip it off. Awesome. So Dr. Patel, what's your parting words of wisdom?
Yeah, I mean, I think it's a lot of what Hyvelle said is be your own advocate and just know early on that this is the original pandemic, is diabetes. Before COVID hit, it's this, and it's persisting. And in fact, if you get COVID and you have diabetes, your outcome is going to be worse. So be your own advocate, take care of yourself early on. A lot of times it's not just family history, it's you eat with your family. And so you're all consuming the same products and you're getting the same disease. It's not necessarily a chromosomal genetic thing. It's what you're putting in your body. So be very vigilant about that and take care of yourself.
Jacqueline, your final words.
Take it one day at a time. I mean, it's easy to get overwhelmed with all of the information and everything there is to know. One day at a time, try to do something every day, positive and productive towards improving your overall health care, whether, watching what you eat, some kind of movement, you don't have to call it exercise, watch your stress levels, because whenever I get, there's so much stress going around these days because with COVID-19 and everything, it just adds to the overall stress. And I think it's really important to be cognizant of that and to, do mindfulness exercises, and also, I rely a lot on my family and my spirituality. Whatever your spirituality is, I think it's really important to rely on those kind of resources and join a support group. Just connecting. Everybody's on, the internet now. There's so many resources on the website, the American Heart Association website, and American Diabetes website, American Diabetes Association website. So connect with other people, and there's a lot of support out there.
And if you don't have a partner like your husband, go to Match.com or JDate or one of those places. Okay. Hyvelle, please.
The first thing I want to say is self-care is not selfish. You have to love yourself enough to put in the work. I know far too long women, we are the caretakers. We bring the food in, and it starts with us. So we have to be proactive and understand that we need to love ourselves enough to put in the work. Granted, every day is not going to be a bed of roses, but every day that you wake up is an opportunity to start anew. So you're given that opportunity. Like I said, a few people didn't wake up this morning. A lot of people didn't wake up this morning. So today is definitely that opportunity to start a healthier you.
Yeah, thank you very much. And all of your comments remind me of the 3 themes of taking control of your diabetes. You have the main responsibility for taking control of your diabetes. You are your own best advocate, and be smart and be persistent. We've had those same themes since 1995, if you can believe that. So with that, I think we'll say goodbye. Thank you so much for your time. I know time is valuable these days, and sharing your personal stories and your professional background. I'm impressed with all of you. So with that, we'll say goodbye.
Thank you.
All right.
Thank you.
Bye-bye.
Goodbye, everybody.